Hello guys!
Hi guys, how's it going?
Yeah, good thanks. Welcome back to the C-Pod. Today we are filming from London, in a different setting.
Different studio.
Yeah, it's not really our studio, is it? Yeah, C-Pod is upgraded. No, we are filming here today because we've got two exciting guests. And today the podcast episode is about side effects and recovery.
Yes, it is. It's going to be very informative, and if you do have any side effects yourself that we have not mentioned, please don't hesitate to message us, and we can share these all out as well. Like, we could share your ones out as well. Make it a thing on Instagram.
Yeah. Just letting people know the reality of cancer.
Yeah.
It's not the obvious. I know pre-cancer or like pre-diagnosis, the side effects that I would have thought of are not the ones that I had. And you only know of it once you're experiencing it, and that can be really scary.
Yeah.
If someone could just tell me before, then you could be slightly more prepared and know what you are getting yourself in for or into.
Definitely, I agree. And I think the side effects that I had, they weren't the most common ones as well, which was really annoying.
No. So let's just pause right there, just quickly. If you don't know who we are, have a look at the cpodcast on our social medias, our Instagram, Facebook, Twitter as well.
Yes, we're everywhere.
Yeah, we're everywhere. We will infiltrate your phones. And as for where we actually put our episodes, we have the visuals and the audio on iTunes, YouTube, SoundCloud, and soon Spotify, and hopefully another little extra as well, but let's not worry about that for now. But if you are in touch with our social medias, you'll know exactly what we're up to week by week, day by day, and that's really exciting stuff.
I know, we're growing. I feel like it's revolutionary, isn't it? We're just like expanding and
covering more topics, getting more people involved. So if you want to be involved, chat to us on our socials, and you could be here, sitting here in the next episode.
Yes, definitely. And can I just say, looking in this camera right now, I swear I'm not that sweaty. Actually,
it's a hot day.
It's actually really bad.
It is a hot day today though, it's a clammy day.
Oh wow.
We've already taken the shoes off.
Really not attractive. Oh yeah, she has. The shoes have come off, the sweat on the forehead, even though it's not actually sweat. I don't know what, I think it's the lighting.
It's the lighting, blame on the lighting.
Always catch us at our finest, guys, always.
So, yes, today we will be focusing on side effects. So we were initially thinking of doing the side effects and recovery together. But when we realised once we started talking, there is so much to talk about. So this episode is on side effects, the next one's on recovery, but they're very intertwined, I would say. They almost come together.
Yeah.
So we're going to look at the half of kind of the bigger picture and the other half next time.
For sure.
So should we just delve right in?
Yeah, of course. So what were your biggest side effects, would you say?
Okay, so when I started chemotherapy, so this was in the start of 2015 now, immediately it was tiredness. Day one of chemotherapy, I went to bed as soon as I got home.
Yeah, can relate.
Yeah, did you do the same?
Yeah. Honestly, you just want to go to sleep as soon as you get home, don't you?
I was nattering.
Yeah.
I felt like I'd been hit by a ton of bricks. And I remember I had family visit me on that day because I'd just been diagnosed and they wanted to see how I was and stuff. And the first day is so hard going, and it's one of the longest days as well, because my treatment was like the day one was full day, and then day 2, 3, 4, and 5 was like half a day.
Yeah.
And so in terms of hours, it's a lot of hours, and it was the first day, so it was.
Because don't you have to stay behind to make sure that you're okay? Like you do, don't you? You have to stay behind for a bit to make sure.
I can't remember, I might have done, but in terms of the actual drugs I had, it was a full day's worth of like kind of thing.
Yeah. The doxorubicin was.
Doxorubicin, vincristine.
Yeah, all the jazz.
Yeah, which sounds like we're literally talking nonsense right now, but back in the day, that's everything. Like, you know all of them, exactly how to say them, and that's just the daily thing. And I think we'll talk about this like in recovery, but like back then you think that's your norm. Like I remember thinking like if I need radiotherapy, then yeah, fine, whatever, you know, that's what it is. But now you think, oh my god, like that's not a whatever thing. That's a massive thing. But at the time you're so used to it, you're almost immune to any shock.
It's your world, isn't it?
Yeah. So day one for me, tiredness. I went to sleep and sickness. I didn't eat, I just wanted to sleep, and I did sleep for a good 12 hours, and that was not enough. And as for eating, I even now to this day remember what my mum made for dinner that night, and it was shepherd's pie. And I literally was like, whoop, like that. No.
Can you eat it now, or?
I used to love like that kind of thing, like very Englishy meat, potato, veg. Now I've kind of gone off it. I don't know if that's just because my taste buds have changed, and they really have changed. I used to be so picky, not exotic in any type of way at all. Now I'm quite a good cook, and I mix things up and I do things differently. But that might be just out of maturity and growing up, or it could just be like that was the turning point for me. Like no more shepherd's pie.
Never again. Yeah.
But yeah, it was. I just didn't want to eat that at all, never. So I went straight to bed, and then I think what hits you immediately, in my perspective, and I know a lot of people I see on Instagram that had AVBD, which is the chemo cycle that I had. The immediate side effects were tiredness, feelings of overwhelm, distraught, oblivion, all of those things. But it takes like 2 weeks for the second round of side effects to catch up. That's what I found. Like in like 2-3 weeks time, the hair started to thin, and that's the next round. So the first bit is like being hit by drugs that you can't even say the name of, and then the second round was losing hair, which people know about that. When you lose your hair, it's like you're publicly declaring you have cancer.
You can't hide it. That's the thing as well.
No.
Yeah.
And although you can wear a wig, you can wear a headscarf, but it is your public portrayal of your illness. So that's the bit that everyone knows about. But the side effects that are internal or with little things, you don't. So hair loss was a massive one for me because my hair was this length, it was long, and it, you know, even cut into a bob, I was really devastated, really traumatized, to be honest. But I think a lot of people experience that, especially women, men as well, definitely. But that was a massive one for me. And then after it, little intricate things like skin dryness everywhere was awful. So like my scalp was so dry, it was like flaking. My lips were so dry, I thought they were like burns. It was so painful, and I was doing my A-level exams at the time, and I remember I was allowed to take medication into my exams because I had like extenuating circumstances, and I had to have this kind of medicalised treatment for my lips. So a lip balm was just not good enough. I had to have proper, the hospital gave it to me, and I had to put it on like every hour because I was in so much pain. That was really bad, and I know other people that have had that, but that was a massive one for me. Like it was, if I had to be in a room for 2 hours, what do I need? And it's like, you know, obviously water, drink, and that was one of my musts. Just to keep putting it on. It was just so painful. What else? I had a mouthwash. It's hard to remember now, but I had to have this like medicalised mouthwash. I can't remember exactly what it was for. So if anyone's listening that is like has a good memory, because clearly chemo brain is another side effect. I had that for something. I can't remember if that was like ulcers or like sensitivity or something. I had something to do with that mouthwash. I think it was ulcers on my tongue.
I remember those back in the day.
I think that was it. It's so hard to remember them all now because it's been so long. Like all the little things I've kind of erased from my mind, subconsciously and unconsciously. But also even like the PICC line, like the sleeve. Side effect of that was I sometimes felt pain with that. Like when I'd lay down, I'd just kind of feel it in my arm and like it just makes now I'm like, oh god, that's awful. And if I kind of put my arm in a funny angle, it'd hurt or ache, and it'd make me really creeped out because I think like, oh my god, something's in my arm. Like, you know when you get a blood test, it hurts, but it's in there for like 10 seconds. That's constantly in there. So when you move, I'm thinking, oh god, it's in there, and then I start to panic, and then I'm even more aware of it, and it's just like a catch-22. Yeah, so I think with the PICC line and the sleeve, the side effects of that were pain and discomfort sometimes. It meant that I had to change my sleeping position, so I'd always sleep on my side. I had to learn to sleep on my back. I was going to say sleep on my front, but then when puberty came, I had to kind of like stop doing that.
I was going to say that's a bit painful, a bit too far.
Yeah, no. So essentially, like I've got no option now. I just have to like start it. And
can I ask, when you had your PICC line, did you find it difficult to have a shower or a bath?
Yeah, this is what I was going to say. So I had to have a plastic sleeve.
Yeah, I have one of those.
From like the elbow right up to the shoulder, really. So anyone that doesn't know, PICC line is the line that it goes into your kind of inner arm, so the top of your arm, like up by your bicep, really goes in there. It's a line that's kind of like bendy plastic, isn't it? And then you have like your little tubes coming out, so when you have your chemo, they just attach it and pump it through. And then in the day, it's covered by bandages. So you just have a bandage around your arms if you've got a new tattoo or something needed it. And then that obviously can't get wet, so to have showers or baths, you have to have a plastic sleeve. So this is what I mean, side effects. It did its job, yes, but I was conscious of it all the time. So sleeping, I'm like, I mustn't roll over, so I'm there just like trying to sleep on the other side or trying to sleep on my back, which was so hard to do because you subconsciously sleep in your comfortable position. As for having a bath, I'd sit in the bath with my arm out, which is so annoying.
That must be so frustrating, yeah.
Well, yeah, because you just have one dry arm and like, you don't feel like you've had a proper bath, you know, because like having a bath you get like right under and it's all soapy and that, but you've got to make sure, like I was so conscious and I thought, I can't put much soap in it because if it gets in and if it gets infected, oh my god, that would be awful.
And I think when you do first have something like that inserted into you, it feels so weird because it's not a part of your, it's not normal, it's not part of your normal everyday. So to have tubes coming out of your arms, have tubes coming out of your chest, it's
horrible. I felt horrible, and even thinking back now, I'm like, oh, it's horrible because you're always conscious of it. You've literally got something in you of tubes coming out, and I just hate thinking of that. You know, it just doesn't feel nice.
Yeah.
But yeah, I was really conscious. Baths weren't great. Showers as well. I didn't really want to take a shower because your whole body's immersed in water, and I thought like if the plastic sleeve isn't tight, the water will drip in. So it's adapting your life. Like these side effects mean that as a whole you have to adapt your life in order to make room for all of these changes.
Yeah.
So example is the shower. I didn't want to take showers anymore. I wanted to take a bath, but then the baths I have to have one arm out. My exams needed extra time because every 45 minutes I'm having to put this medicalised stuff on my lips so my whole lips don't shed another skin or something. As gruesome as that sounds. And even like at the time I was kind of doing my exams and revising for my A-levels, but instead of my revision schedule being 9 to 11 a.m. economics, 11 to 1 geography or whatever it is, it was 9 to 11 economics, and then in that 15-minute break, what tablets do I need? Like 6 tablets, and then the next 2 hours, and then the next 6 tablets, and having to include that now in your life, like that is your new normal. And I know that phrase is chucked around a lot, and it's kind of like, oh yeah, whatever, but really is like
you do get used to it, don't you?
Yeah, you do get used to it.
Without even realising it.
No, at the time I was so kind of blasé, like next 6, or radiotherapy, chuck it at me if I need it.
Yeah. But you don't have a choice either, do you? So it's
that's what it feels like. I know everyone will say you've always got a choice, and now with the mindset I know, maybe, but I could have tried to do alternative things, but even at the time you feel like you're backed into a corner, like yes, there maybe are other routes, but at the time it's like you have stage 2, 3, 4 cancer, you start treatment right away, this is your treatment plan. It's like you don't have time to think about these things. And as for taking the tablets, having the PICC line situation, the lips and the hair and the weight gain, it almost is just like, it is what it is. And right now I look back and I think, how was I just so comfortable with it all? It made me really upset. I was devastated and I was very low for a while, and lonely, to be honest. Like it is quite a lonely thing because everyone tries to help it.
No one understands, do they?
Yeah, it is. I kept saying, like, I don't want to take it out on other people. I was like, yeah, that's great, but I'm still fighting it on my own.
Yeah.
You know, like, you're not fighting it for me. But obviously that's not a great thing for them to hear, but that's just how I felt. But I just, you have to embrace it, and all of those things were just the add-on, you know.
Yeah.
And now I look back and I'm like, that's a massive thing. Like, radiotherapy, why was I just like, yeah, go on, that'll be the next thing. Fortunately, I didn't need it, but you get to a point in terms of all of these side effects, they rack up, and you just feel like, yeah, I kind of have to expect this, and you have to embrace it. What's the alternative?
Yeah.
You can't reject a side effect. You just
No.
have to be like, oh, okay, my hair's gone, so what do I do now?
Yeah, and I think when you go in, obviously you don't have a choice to go into something like this, but when you are faced with cancer and you're going in with this treatment plan, you know that you're not getting out the other side completely fine. You're going to have to go through hell to get to the place that you want to be.
But you never quite know what hell is. Like,
No,
what
exactly,
it is.
exactly.
So I had no idea. I knew it was going to be tough. I had no idea. And now I know what it is. We've got an episode of Mission and Relapse that's already out, but now I know how bad it is. I don't know if I could do it again, if I had to.
No.
Whereas before, because you have no idea what is in store, you kind of just do it and you don't know what it means. But like the thought of experiencing all of those side effects and treatment and the illness and the change in identity and physicality, it's just awful. But yeah, for me, side effects massive. They're all completely different in completely different stages. Biggest for me though were weight gain, because they were visible to everyone and something that I felt like I could do anything about, and it was so drastic. And hair loss, because also I think those two are massively impactful, massively extreme. To weight gain, put on over 3 stone, like changed like plus 3 or 4 dress sizes probably. Hair loss as well, so drastic. It's not, some of it's gone, all of it's gone. So, and it takes such a while to bounce back. Like the weight, you know, you can live a healthy lifestyle and all of that, but tomorrow you're not going to be fine. It's going to take a couple of years, and that's just to do it healthily anyway, and that's what I'd always want to do. And same with hair growth. You can't, you just have to be patient.
Yeah.
So those two, weight gain, hair loss, massive ones, because of how extreme and how long they took to get back. And it's only now that I'm feeling truly like myself. Like,
that's good.
Yeah,
it just goes to show how time precious is and how long it actually takes to get back to how you feel like when you feel like your own self again. It's not just you snap back. It's not.
No, definitely not. And I don't even think there's like a line where I'm fine now, you know, where it's just like, it's like you cross the finish line and then it's all fine. I think slowly in dribs and drabs it starts to get better, like slowly the side effects start to diminish, or slowly things start to get easier. Because I think now I'm mostly fine, but there's like probably not much, but it's probably a couple things still lingering, just in terms of...
Yeah, I don't think anyone that goes through something like this can ever come out the other side and say they are fine and back to their normal self in terms of forgetting about it or something like that.
What I learned as well, my goal throughout it all was just to return to who I was before, and that's never going to happen. I think that's important to know. It's a harsh reality, because at the time you're like, all I want is the life I had before and to look like I was before. But now I'm out of the woods, and on Daily Life I put on our Instagram that my life is kind of decancified in terms of I'm not really that affected by cancer anymore, but still I'm not the person I was before. I'm not the Beth before.
No.
You're just kind of you, with maybe a few extras and a few minuses as well, and hopefully it's for the better.
Yeah, I agree. I completely agree. I don't think anyone comes out of this the same person that they were before, and it must be worrying if someone actually is the same person that they were before, because what did you learn from that? You know?
Yeah, I think it challenges your mindset in terms of side effects as well. Apart from the obvious side effects, something we should mention is mentality. The side effect of going through intense treatment from changing physically is your mentality just changed. And obviously everyone has different experiences, some change more than others. For me, I've changed massively. Oh my god. And it's so funny because I felt like I lost so much as I was going through it, and now I'm at the other side. It's like those things kind of want to return to me, like people or things I used to do, and now I'm like, no thank you. And it's ironic because 4 years ago all I wanted was that back, and now I realise I can do better, or I am a better person, so I don't need that anymore. So I think mindset is a massive side effect, and it's more of a hidden, subjective side effect.
Yeah. No,
I'm sure the majority of people feel that way, because how can your eyes be open to such an experience to actually think about your mortality and for you to go back to the ones that you had before?
Yeah, exactly.
So what other side effects did you experience like throughout chemo? Because you, just for people that don't know, we both had chemo.
Yeah.
But I had Hodgkin's lymphoma and you had leukemia, so our treatment and the course of treatment was slightly different.
Completely different. I hope you guys can get a cup of tea or something, because mine is so long. Sorry, so what was your chemo? Was it
I had AVBD.
See, I'm not sure what mine would have been different, I think.
Yeah.
But mine went on for 2 years. And the very first day that I was given chemotherapy, I developed this side effect. So before I had my chemotherapy, my nurses prepped me and said, okay, you'll probably feel a little bit tired. This drug is going to make you lose your hair, but it won't come out straight away. It will take about 2 weeks. And you might get mouth ulcers, you might develop constipation, just the basic general stuff that a lot of cancer patients go through. And then what they don't really tell you anything above that, do they? It's just the basics. So I had my first round of chemotherapy, and I was like, I was terrified. But when it was happening, when you look at it and you think, oh my God, okay, it's going in, I can't stop this. But after I had it, I just kind of felt to myself, oh, is that it? It doesn't seem that bad. And then over the night,
and then it hit.
Yeah, over the night, I developed a disease called tumor lysis. And to this day, sorry, I just kicked you there. To this day, I don't have a proper understanding of it. So if anyone out there who has had it or knows what it is, feel free to let me know. But I've briefly read up upon it. But the next day they were panicking. They were going to send me down to intensive care. But instead they had someone from intensive care come up and keep on watching me every half hour. Every half hour I had to go on a nebulator. But I felt completely fine in myself. I just didn't know what was going on inside my body. But basically, all I kind of know is that the chemotherapy worked extremely well. So instead of suffocating my cancer cells, it just basically essentially bashed straight into them, burst them open, so it released loads of potassium around my body, and it was getting into my bloodstream. I don't know anything further than that. And I remember one day I went down for my lumbar puncture, and I said to the nurse, once I overcame this, because if they couldn't get it down to a certain level, I would have had to have gone down to intensive care. But I felt completely fine. I did feel a bit tired and a bit weak from side effects from my diagnosis. So this is from the illness itself, not the chemotherapy. But yeah, I remember going down for my lumbar puncture one day, and I said to my nurse, oh, do you remember when I had tumor lysis? And she was like, oh, yes, do I? Because she was she treated me. And I was just like, yeah, I never really fully understood that. And she was like, phew, basically just say, her expression said it all. And then I just said to her, so I don't know what it is, but what would have happened if it wasn't treated? And then she was like, she basically said to me that I could have gone into organ failure, heart failure, and stuff like that. And it was then I was just realised, oh my God, but to think that I actually felt relatively okay for something that was really, really serious.
I think maybe you felt okay because it hadn't escalated.
Yeah, and the thing is, I suppose where it was happening inside my body, I couldn't feel anything.
Yeah. That's crazy.
Yeah, so that was day one.
I bet after that you were just like, oh my God, where's this going to go from here?
Well, the thing is, they never really, I think because it was all raw and it was all new to me, I don't think they properly they told me they didn't tell me, sorry, for a reason, what was going on. But yeah, I just developed tiredness. I slept all day, every day. As soon as I got home from chemotherapy, mouth ulcers, and again, I had a mouthwash called Deflam.
I think that's what I had.
And it just numbs your mouth, doesn't it?
Yeah, mouth ulcers were really
bad.
bad.
It's horrible, especially when they were you're in your tongue. No, I had them right at the back where my tonsils were, and it was just why won't you go away? And it's weird because when you say mouth ulcers, I know people know that they are painful, but this just isn't the one. This is 10 of them in one go, and they're not small, they are huge. Constipation was a very big one for me.
Yes, that's what I forgot to mention as well.
Yeah.
Did you have loads of like different drugs that were supposed to like ease you, and then like then you get let's just put it this way, then you get too eased, and then like you take something else to like block you up a bit, and then you go right the other way, and you're literally just like, my body can't go.
You can't know. I had laxatives to obviously help me go to the toilet, and then once I'd and then to actually help me go to the toilet, because this is a bit
X-rated.
Yeah, this is a bit too much, but I think if we're gonna talk about something like this, we should just be open. So was your poo hard when you went to the toilet? Like, did you find it really hard to poo?
I'm gonna be honest. It was like 4 years ago. I don't really remember. I think
That's good.
I know I did have trouble because I know I was on like different medication.
Yeah.
And all I remember is that it was one extreme or the other. As soon as I was at one extreme, they gave me something to ease it, and then it literally went the other way.
Yeah.
And I felt like my body could not regulate it anymore.
Was you given like the yellows, lactulose, like the substance where you just it was a bit like it's just like an ordinary medicine, and you take it and it really it's sweet and it really softens up your poo.
I can't remember. I think I probably did have laxatives.
Oh yeah, they were like life.
So tell me about your experience with constipation. Cpod today is talking about.
How have we got this low? Like, honestly. Oh god, sorry guys.
Oh my god, we're so much more comfortable than episode 1.
It's about to talk. I never thought that I would talk about poo on a podcast, but here we go. Here we are.
To be fair, poo is actually a really important thing for cancer such as bowel cancer. It can be the telling point of how ill or not you are. So
yeah, definitely. With mine, so I think at the beginning it was okay, but from day one they kept making me take laxatives and lactulose because they said that my poo would become really hard. And by that I didn't really understand how intense it was going to be. It's an experience I'll never forget. It was horrible.
Cheers to that, everybody.
So I think I went at least 4 days without pooing quite a lot.
Oh my god, that's awful.
With laxatives, yeah. So as you can imagine, all of this, not that I ate a lot, but the food that I did eat was just building up inside of me, and it just became very painful. So when I finally did go to the toilet, it was very, this is going to be very graphic, but it was very sharp. It cut.
It's painful. Oh my god.
My skin open. So I bled a lot when I went to the toilet when I did a number 2, and it got to the point where it hurt so much that I used to fear going to the toilet, and when I knew that I needed to go for a poo, I would try everything that I know it's really bad, but I would try everything that I could to put it off, essentially, and
which actually makes the problem worse.
Yeah, definitely. And I remember sitting this one time. I don't think I went for at least a week, and I remember sitting on the toilet, and this is another side effect that happened as well, which caused me to lose ability to walk on my legs. My mum had to take me to the toilet, and I remember her holding my hand while I was attempting to do a number 2, and I was just sobbing through the pain, and it was just, yeah, it's a bit graphic, but I mean, this is reality.
These things you don't know about.
Yeah.
Who really knows about this? I don't know anyone I can actually find this about.
No, that's the thing, and no one really, and I suppose because it's poo, no one really speaks about it, do they? But I remember being in conversation with this one girl, and she said to me, "Oh, do your poos really hurt when you go?" And I was like, "Oh my god, I found someone that knows that, like what I'm going through." Yeah, so I can feel the pain when I think about it, and it's just so horrible. Yeah,
I feel like that's something that now we take for granted.
Yeah, no, definitely.
Like, it sounds so silly, but at the time, like, our balance was just not there. There was just no normality. It was just medication, simple things like that we just couldn't do. So now, think about it twice when you go to the loo.
That's the thing, and I remember when I finished treatment, and my constipation was easing a little bit. Even then, it took me a while to actually get used to going to the toilet and actually being okay and not scared to go again.
That's so interesting.
Because it was so bad. So yeah, that's my poo story for you guys. I hope you enjoyed it. So that was another huge one for me. And then I would say, so I was diagnosed in November, right? Yeah. So a month into chemotherapy, I then had these injections in my legs, which it's a certain drug. And basically it's a form of chemotherapy, but they inject it into the muscle, into your leg, both sides. And one day I remember one leg completely hurting and I couldn't walk on it, I couldn't cross my legs or anything. So the day that I went in to have my portacath inserted, I said to the nurses, look, my leg is really hurting, is there anything that you can give me? So the next thing they said to me was, okay, we're going to send you down for a scan. And I was a bit like, no, I don't want that. But they was like, no, we need to, because it can actually cause, the chemo you're having can actually cause blood clots. So straight away, I knew, okay, no, my luck, yeah, it's going to happen. And that's exactly what happened. I went down and she basically, it's almost like a pregnancy scan kind of thing, where they,
ultrasound.
That's the one. Oh yeah, that's the one. Went out of my mind there. Yeah, so she basically gelled my leg up and then she scanned it and everything, did the ultrasound.
Going all cockney.
Yeah, she did the ultrasound and it came back. She said, oh yeah, she showed me the screen and she was like, oh, if you can see this tiny little ball, yeah, that's a blood clot and it's been there for a while, so we need to get you into injections, like on injections straight away. So that was a bit of a down day because obviously you don't want to have a blood clot. And then as I was actually having my ultrasound done, I could feel a pain sparking up in my other leg. So then I said to her, I was like, can you really quickly check this other leg, because this has literally just started to spark up and I don't know if it's because you've told me I've got blood clot in this one. My mind is now thinking, oh, like, check the other one. Am I thinking about the pain? And she was like, yeah, no problem. So she quickly ran through my other one and then she was like, I'm really sorry to tell you, but you have got a new one that's just formed, it's fresh in this one. And my mum started to cry because obviously having cancer is one thing, which I know is a lot worse than a blood clot, but a blood clot's still scary. And she just said, she was like, it's treatable, don't worry. And I was given a huge box of injections that I had to inject myself every morning and evening.
That's like my worst nightmare.
And that's the thing. They were tiny little things, but when you first had them, it was a bit like, okay, I can deal with this. But once you have it every single day for 6 months, like day and night, the tissue starts to bruise over and you have to insert it in the same place. So
I could not have done that. How did you do that?
Well, at the beginning it was okay, but as the 6 months went on, I obviously got more weaker in myself as well. And I just didn't want to do it anymore. And I remember I used to fight against my parents to try and not let them, because I used to have it at the back of my arms. And I just used to be like, nope, you're not touching me. And in the end, they had to call up the hospital and just say, look, she's not taking them. Is it okay if she misses like the odd one? So they was like, yeah, but don't make it a pattern because obviously this is serious. We need you to do them. But it just got to the point where I was just so sick of having them. But because of my blood clots, I also lost the ability to walk as well, and the strength of my legs are completely gone. So I was wheelchair bound for a few months as well. So
I never saw you in a wheelchair. Was that?
It was not. When did we meet? We met towards the end, didn't we?
I think so.
Yeah. So this was like the second month in. I was wheelchair bound up until I think like the third, fourth month into the next year maybe. But I slowly began to walk once they had like completely cleared out, but then it wasn't just being able to walk, it was learning how to balance myself again.
So what's the situation with that? Did they say there's chance of the blood clots returning, or were they just like a one-off thing?
Nothing's actually been said about that. I had the scan after my 6 months of having these injections. They done an ultrasound on my leg again, both legs, and came back fine, it completely cleared. So they just said, good to go, and nothing's been mentioned since. So I don't know if it's a case of once you've had it, that's it. I think it was the drugs, the drugs definitely did it. Sorry. So
unless you had a pain, it's just not something you would think about. There's no reason to worry yourself, otherwise you'd have a whole list of things to worry about.
No.
As a cancer patient, I think you'd have a whole list of things to worry about.
Definitely.
Focus.
And the thing that helps me with the blood clots as well is that I actually noticed that so many patients, when I was being treated, so many patients were being treated for blood clots as well. So even though it's a scary thing, it's terrifying, it actually made me feel a lot more at ease knowing that this was actually very common for cancer patients to get. So, which is very weird, but again, you accept it. Like, it becomes your norm.
It's like another hurdle. It's like, oh, well, this was a side effect of the treatment, so you just got to accept it. Did you get joint pain? That's something that I forgot to mention, but that caused me excruciating pain. I remember there was nights I just didn't sleep at all. And I still remember now being sat up on my bed, my knees into my chest, and every joint just like burning. That my wrists, my knees, my ankles, and bless my mum. My mum would run up the stairs, run down the stairs, put the heat pad in the microwave, run up the stairs, heat pad in the microwave, up, down, I'd have heat pads wrapped around everything. And it's like, that was awful. I think that was Vin Christine that caused that.
It was, Vin Christine, because that, did you lose your stability and stuff when you walked as well? Like,
I don't recall, but maybe I did, but just didn't really realise.
On the odd occasion, I could walk absolutely fine, and then on the odd occasion, I would just collapse, but it was just my legs just completely gave way, the joints. But it causes joint pains, doesn't it? And you lose your stability quite a bit. But
joint pains was massive. But I think this, in terms of like focusing on the wider picture, I think this is like one of the many difficulties of cancer. When you are experiencing these side effects that people don't know about, they don't exist to anyone else.
No.
You're going through them yourself, and that's where kind of the aspect of loneliness or being isolated comes from. Because I listened to something that was really resonated with me, that just says when you're diagnosed, everyone rushes in. What can I do for you? What can I do for you? Oh, I hope you get better. Gifts, flowers, everything. But side effects like that, no one knows about it, which is why first we're doing this podcast, have a bit of awareness. If you know someone going through it, they might actually be going through joint pain and they might need a bit of help. And for that one person to say to them, how can I help with joint pain? It's like, wow, you've gone above and beyond. But secondly, it's people don't know about it, so when you go through it, you're experiencing it on your own. I remember like being in bed, clutching my wrists, my ankles, my knees, and I was just like, no one knows about this. Like, this is horrible. No one can help me. Everyone is completely oblivious. And it's just so crap.
Yeah, it is. It really is. That's the thing. And I mean, like, you say stuff like joint pain and hair loss. I know hair loss is scary, but like ulcers and constipation, just the whole lot. It just, you think to yourself, oh yeah, but every day, an everyday person can get that. Yeah, they can, but it's
the magnitude of it is times 100. Like, I've never seen like skin dryness for me. Sometimes I get dry skin, like maybe if I've been in the sun or like I've been in a swimming pool or something. I come out and I'm like, oh, I'm pinning a little bit here. But it was skin dryness to the point of like, I felt like a snake. And it was, I always say it was medically induced. So when your lips get a bit dry, you're like, like if you've been to the seaside and it's been a bit windy, you think, the winds, cause this. I put a bit of Vaseline on, which has a lot of chemicals in it, but that'll be fine because it's not intense lip dryness. It was to the point where I needed something that was medical with no crap in, that was organic, that was pure, because it was so fierce. Intense, and it resonated burns, like it was just stripped. And all of those things are so intense because of the intense drugs. Like, those things can happen to a regular person, but I know now if I have like skin dryness or lip dryness, it's because of my environment or what I've put on them, but that was due to drugs.
Yeah. I think another thing as well that I found quite difficult, especially tiredness, yes, now I still get extremely tired. Like, I've just been on holiday and I've come back absolutely sick and exhausted. But that's just my immune system, I think, because of the chemo. But a thing that used to get me quite annoyed a lot was when I would say to people, oh, like if someone said, oh, do you want to come out today? Or, oh, do you want to do this? Or why don't you try and go out more if you're feeling tired? And it's just like, well, I'm tired. You don't understand my level of tiredness. And then someone will make a comment and say, oh yeah, but sometimes I might do that and get tired still. Like, I get tired too with that. And it's just like, well, no, your tiredness is completely different to how I'm feeling.
Yeah.
Did you ever have that when someone said, well, why don't you go out and try and do stuff if you're feeling tired? Or they'll say, oh, it's because you're sitting indoors all day. Like, no, it's not. I'm telling you, it's not that kind of tiredness. I wish it was.
Yeah, medically induced. Fortunately, I didn't really have any one like that, but I think I kept myself so busy, it was almost the opposite for me. People were like, slow down, like, are you okay, chill out, because I think I went into a bit of like a like tunnel vision, had a goal and it just wasn't going to change. But I 100% get that, because even now, like, I feel like fatigue, I get tired, but I've always been quite not saying you're not, but I've always been quite like bang, 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 bang with work. Yeah. So if I get tired, I'm kind of used to it. But what has changed is I am aware of the tiredness. So when you say like back in the day you were tired, I'm like, I get it, because it's like the little things take it out of you. Like now I might walk to the shops and it's like, yeah, I'll just walk to the shops. Back then I could barely walk because my joints felt broken. I felt like it was going to break beneath me. I was so stiff, I ate, I felt ill, I felt weak, like so weak. Walking to the shops would be like the equivalent of me running a 5 or a 10k now. Yeah. So it's a massive thing. So if I did that back in the day, I'd be so tired. Yeah. Just recognition of that, I think. Yeah, definitely, I agree. I think it's just, it takes such a toll on your body now and back in the day, but it's just it's the understanding of what all of these really mean, because they are common in everyday life, but it's just completely different in the cancer world, isn't it? Yes, 100%. And I think if you are listening to this and you don't have cancer, you're already halfway there by having an open mind and wanting to learn about it and know what the reality is. It goes beyond hair loss or weight gain, because I think those are, or weight loss even, some of you might have had weight loss. Because those are, as I say, the public side effects, the things that are revealed to all, but there are things that you have in the middle of the night, like for me the joint pain, that meant that I was on top of the fatigue. I haven't slept at all.
Did you get insomnia from the steroids? Like, did you, because with me, for the steroids, they kept me up all night, and it was just, my brain was like overworking, like, oh, you could be doing this, you should do this tomorrow, oh, be productive and do this. And even though I couldn't, by productive I mean like writing a blog post or something, because I was too sick to actually be that productive and go out and stuff. But my mind was constantly like, right, do this, do that, oh, you can do this, oh, think about that, you should watch this now, but you have to do it now. And it was like telling me that I need to do it now, and if I didn't, I would become so frustrated in myself. But it just worked so much that I just didn't sleep.
I don't think I did, to be honest, because my days were quite packed. Yeah. So I do think that once it came to it, I was kind of out like a light. But there is an element of restlessness, I think. Yeah. I was so uncomfortable in my body. I just felt so uncomfortable, just who I was, and just pain, agony. And it's hard to describe like what the pain is. It's just like a variety of things. Yeah. I can never describe what it's like. No. It's horrible. It's just like a pounding. But it's everywhere. It depends on like, I feel like the chemo makes you sick, not the cancer a lot of the time. Oh so, yeah, definitely. So depending on the chemo and the side effects, that's the pain that you'll feel. So for me it was like my joints were weak, my bones were weak, and I just felt that my bones are weak, you know, like I would constantly like click or I just knew it. I just feel they were so like brittle and weak. And the joint pain, the lip burning, the skin dryness, just pressure on your body, I think.
Yeah, and I just think your body gets so run down anyway. It just feels like, you know, when you're absolutely exhausted in general, when you can just feel like heavy weights on your shoulders, and it feels so like you're crippling, like you're just crippled essentially. And so yeah, I just feel like that's genuinely how you feel when you go through chemo and stuff. It's just like all of this stuff is pressuring you down, isn't it? And then it's just like, can't get out. You want to get out of it, but you can't, and it's tough. And I think another huge important one to discuss, which I think all of our cancer friends out there can so relate to, if you can't, I think you should be a bit worried. But is neutropenia, being neutropenic.
So you're basically, your white blood cell count is low. So as far as infections go, if you get something, it's quite deadly, to be honest.
Yeah.
You're weak, you're vulnerable. I see it as almost like an empty tank, so you don't have anything to fight because you've got no fight left in you.
Yeah, and it's like when you have cancer, it attacks all of the good cells in your body. So the chemotherapy attacks your bone marrow, which produces this white blood cell called neutrophils, and when it suffocates these cells, they just decline, and that means that when you do have an infection, obviously there's nothing there to attack it. So.
Yeah. So I know I was neutropenic quite seriously, like a lot of people.
Too.
I think it's like, I can't remember the exact count, but mine's like 0.0001 or something like that.
Yeah.
Which means like you hardly have any white blood cells, if any.
Yeah.
And they say when you're neutropenic, you have to limit going outdoors, you have to limit socialising, you really need to like be to yourself.
Public spaces and stuff.
Yeah, no public spaces, no public transport, because what might just be a germ on the table, if you've got no immune system, white blood cells to fight it, that will escalate and escalate and escalate.
Yeah.
Which is why a lot of people get pneumonia and bedbound when they have cancer, and then sometimes it's not the cancer that kills you, it's something else.
Yeah, from neutropenia.
And you have to be careful. The thing is though, I'm such a hypocrite. Like I was neutropenic and I didn't really realise the severity of it. So I took public transport every day.
I can't believe a busy packed train.
Yeah. So I took the tube to and from hospital whilst I was neutropenic. I think that's because at the time, as we said before, the next thing comes and you're like, oh yeah, go on then, like take it on the chin. Which is good because it felt like nothing can faze you, but then also like I was very blessed to come through that really. Not because a lot of people have sepsis or infections, and then as a result they have to delay chemo and go to intensive care or be an inpatient, and it's keeping up that mobility. So I tried to keep it up all the time by going on the tube, and that was my way of proving like, yep, I'm going to go to hospital on my own, and I'll get there, I'll be an outpatient and I'll just go in there and fine. But that's a dangerous game to play.
If that was me, I'd be undefeated straight away.
Yeah, it's hard. What about you? What was your neutropenia experience?
So I felt like it haunted me throughout my whole journey. Every week I was neutropenic after I had chemotherapy. So I swear I had, at the beginning, it was okay. And then when it got too intense for me, it just dropped. And I remember one time before Christmas, I asked if I could go to the theatre. So every time I wanted to go out, I had to go in for a blood test to see if I was able to go out. And then my nurse was like, yep, you're absolutely fine, go ahead. So I went out to the theatre, and then the day after, I had another blood test because I had chemotherapy, and then my neutrophils, I think my neutrophils were something like 2 point, I know that was lucky actually if it was like 2.1 or something. It was like 1 point something, and then the next day it was 0. And they were so shocked at how quickly it dropped, so they were like, no, that's an error. So they took another load of blood and then tested it again, and they were 0. So my neutrophils were pretty much on 0 a lot of the time. And I think one thing that was quite difficult for me when I was neutropenic was I took it very seriously. So as soon as they said, right, you're neutropenic, I did not go out the house. I tried to socialise with as little people as possible. But I think that's what made it very difficult for me, was when I was able to go out, I tried to as much as I can if I was feeling up to it, but then if I put it on social media, or I don't know, if I went out with one friend one day and then people saw, I don't know, and then I went in for chemo and a blood test the next day and I was neutropenic, because for me I could be fine one day, the next day dropped. And I think that's what made it difficult, because people began to be a bit like, well, you went out yesterday, why can't you go out today?
But it's also the fact that like you feel like you can't plan much.
Well, that's the thing, it ruined plans as well. You could never promise that you could make a plan, because you don't know on that day whether you're neutropenic or not. And my luck, I wasn't, because that was one of my biggest side effects, neutropenia. And the weirdest thing is throughout my whole intensive chemotherapy for my 6 months, I was neutropenic and never got admitted into hospital. And then the moment that I went into maintenance and had less chemo, it was less intense, and I could slowly go back outside, I was admitted 3 times because of neutropenia.
Well, was that like an infection, or what did you catch?
Yeah, so the first time it was an infection, they weren't quite, I think it was like a bladder infection. Second time, yeah, me and my bladder, right? Second time it was neutropenia sepsis. And then the third time, I think it was just like a general cold, but I had a temperature because of it.
Yeah.
But it's weird how this entire time during my intensive, it was absolutely fine, even though I was neutropenic. And then the moment that I was actually able to go out, my immune system was like, nope, not today. And in the hospital I went.
Yeah. And that's so interesting, because all of that can have an effect on your mental health. So being restricted to when you can go out, who you can go out with, isolating yourself. I know a lot of people that haven't had cancer, but when they have experienced like a short-term illness or physical, breaking something, whatever, or a family event, and they've had to isolate themselves, doing nothing and isolating themselves creates like a mild form of depression and feeling low. So being neutropenic and hearing you can't go out, you can't do the things you enjoy, or you can't see the people you want to see, you can't plan a diary, maybe.
You can't, no.
It can be very debilitating. It strips away what you are and who you are spending your time in and what you're doing.
Definitely, and I think that definitely affects, once you are able to go out and do these things again, I think it definitely has an impact on anxieties and stuff. I remember the first time that I went out on public transport for the first time, or I don't know, like just general eye contact with the public, the people you don't know, strangers, you kind of feel so isolated. You've been in isolation for so long that it's almost like, oh my god, I'm in the real world, and it's almost like, don't look at me, like don't look at me, don't talk to me, I don't want to speak to me. And you also like use yourself.
Someone coughs and you're like, and then you think, oh, I'm not neutropenic anymore, but still I'm like hypersensitive. Yeah,
that's the thing. And I remember going onto public transport, I would refuse to touch like the handles and the rest arm, like the armrest, on in between the tubes and stuff. Yeah, I would just sit there like, and then if someone coughed, I'd like move and no, do not come near me.
That's so interesting. Did you have any other side effects? I feel like a lot of ours overlap. So I got neutropenia, joint pain.
Yeah. Another one, I think a very common one for leukemia patients is blood transfusions, and that was probably, apart from neutropenia, that was probably my biggest in terms of how often I had to have blood transfusions.
So for people that don't know, why do you have to have a blood transfusion? What is it for?
So, I haven't explained this in a very long time, so I could be wrong, correct me, but from what I can remember, your bone marrow, so where my cancer was, it was in the bone marrow, it produces hemoglobin cells and white blood cells, including neutrophils, what we just spoke about. And when you have chemotherapy, this chemo will basically suffocate your bone marrow, which stops it from producing these cells, these healthy cells, including your hemoglobin, which is your red blood cell. It's literally what you would do if you was given blood. It's that kind of blood, the red blood. And so it suffocates it, so obviously you don't produce it, but it also kills off the cells as well, so you essentially lose your hemoglobin cells, as well as it stops producing, so you really don't have any source of blood cells. So you have to have blood transfusions constantly to perk you up, to help you live.
To replenish the
Yeah.
stocks, really.
Definitely, and I think over my entire time during chemotherapy, I think I had about over 30 blood transfusions. And they're just such boring days. I remember I used to get so upset because at first it was like an extra add-on, so I would have chemo like 3-4 days a week for like, I don't know, 4 weeks ahead. And out of those 3-4 weeks, I would then take another probably like 2 days having blood transfusions. So my entire week was just hospital. And yeah, so that wasn't fun. If you've had a blood transfusion, you would know that they are not quick days. They go on for about 6 hours, but that's not including going up there, waiting for the blood to come, which takes like an hour, 2 hours, depending. And all you do is essentially sit there. It is like giving blood, only that instead of giving it, you're having it inserted into you. But it makes you feel like a new woman once you have one. I'm not joking. You feel like you can run a marathon. But if you don't have, it's interesting because if you don't have a blood transfusion, which, I mean, it's not good if you don't, but if you need one, your symptoms will be, you will feel really depressed and you just start crying. And I remember the first time that I needed one, but not knowing that I needed one, I got really moody and I started to cry. I lost my appetite. I felt tired all the time, and it's weird how that affects your mood, and you can completely tell the difference after you've had one.
Yeah.
But yeah, I became so used to them that it was just like, I knew straight away that week I would need a blood transfusion. It just became a part of my daily routine. But I think that is a huge side effect in a lot of leukemia patients, which in the long run, it's not the worst side effect you can have, because there are a lot more serious ones out there.
Do you have any long-term side effects? So things you experience now, like 4 years later?
Yeah, so there are days when I get really fatigued still, and there's days when I struggle to get out of bed, and if I was to have a shower and stand in the shower, and it's just like, I feel horrible, I will have to take myself back to bed. I still get joint pains and stuff.
Oh, right. Interesting.
What else? My immune system's rubbish as well, as you can tell, because it's not good. But I can't do intense days. If I do an intense day, I know that I would have to make up for it for a day after.
Okay, yeah.
But what about you? Do you have anything or?
To be honest, I don't think I do. And if I have, I've pushed past it. And I'm not saying that in terms of some people, you don't put enough effort to push past. I'm not saying that. But I'm saying that I never gave myself a rest period.
Yeah.
So I think I found the first 2 years after chemo especially difficult because maybe I didn't get the rest that I should have given myself, or the time needed. So I think now it's the perks of that is it's quickened the healing process, the recovery. But as for long-term side effects, not that much really. I think just massive side effects, mentality. I think I have completely shifted my mindset, different interests, different way of thinking, which is great. I really appreciate that now. So for me, 4 years later, I don't think of the negatives as such anymore.
No,
I have to remind myself of like, oh yeah, that was rubbish, or yeah, that happened. Now, I finally got to a point where it's mostly just benefits.
That's good. That's good. It's nice to know that like you can go through an experience like that and
you get
come out. Yeah.
So our first guest is Derry. He is a great lad.
Love him to pieces. He is a bit of a local legend, as we like to call him.
He's going to chat to us about his experiences. He has completely different side effects to us, which is why we thought it was so important to bring him on. Right, so here we are. We're welcoming our first guest.
Yes, thank you so much for coming on.
No problem.
And if people don't know, Derry here, so we've got Derry on with us today. And if you are not familiar with Derry, he is a very, very popular face amongst quite a lot of cancer survivors and our cancer friends, aren't you?
Yeah.
You're a bit of a legend, aren't you?
He's like,
Part the furniture.
Everyone knows Derry, so if you don't know, get to know Derry.
Yeah. So we should probably add a bit of context there. How did we meet? We met through Teens Unite, didn't we?
Yeah.
Fighting Cancer, who are a great charity. And Derry, would you like to give a bit of background as to like why you were even supported by Teens Unite? Like, who are you? And
Yeah, well, I got diagnosed when I was 20 in the National Hospital at the time, and it was just when I started my treatment at UCH a couple of months after. It was actually my support worker through Click Sergeant that told me about Teens Unite. I was diagnosed with a benign brain tumour that if it weren't spotted or treated, it would have turned cancerous, and if they would have operated on it properly, because where the tumour is still there but it's very small, but if they did operate, it would have left me pretty much wheelchair bound for life, paralysed sort of thing. And so the only way they could treat it was with real intense radiotherapy.
Okay. Yeah, because that's something we have both not experienced.
yeah, which is interesting
Yeah.
because you've obviously had surgery, haven't you?
Yeah, well, yeah, surgery was the biopsy done in it, but it was both the side effects of the biopsy and the radiotherapy that kind of really really affected me. Yeah.
What were those side effects?
Well, it was when they first done the biopsy. When I woke up, they hit a nerve. I found out that they hit a nerve in my left eye. I've got something in my left eye called nystagmus, where the eye doesn't focus straight. So I couldn't, even with my normal glasses on at the time, I couldn't really see properly. And when they done the biopsies as well, it messed my balance, and I wasn't able to walk again, basically.
And that's something that you've had to work on a lot over time, haven't you?
Yeah, definitely.
Which
I mean,
incredible
even now, I still get dizzy spells. I still have a real major problem with steps and stairs.
Yeah. So when you were diagnosed and you had this biopsy, what were your, I know you said that those were your side effects, but how did you feel towards that, and how did you deal with those side effects?
It was just a real big shock to me, because at that time when I got diagnosed, I was just ready to start my life. Really, I was in a job. It wasn't the best paid, but it was the normal amount at the time for an apprentice at that time. So I was in a good job at the time. I was ready to move out of home, ready to start my driving lessons, and messed everything up, because I thought I was going to be that way for the rest of my life, basically.
Yeah.
And it really got to me. I cried myself to sleep a few times in the hospital, waking up to pillows that were obviously wet with tears and all that.
Of course, it's a massive life change. You're at 20 as well.
Yeah.
And having a brain tumour that you just don't, that must have scared you. Like you don't know what it involves.
It did, but because I mean, I've never really been over religious or whatever, but just the year before that, I actually took a group of sick and disabled children to Lourdes in France as a helper, because The charity, they took me 3 times as a kid because I had bad kidneys all my life, and so when I heard the news that I've been diagnosed with a brain tumour, it kind of like felt a kick in the teeth basically.
Yeah, of course. So you mentioned briefly that you had your biopsy, so that's almost the first stage, isn't it?
Yeah.
For a lot of cancers.
Yeah.
For people that don't know, because they test, is it definitely cancer? What is it?
Yeah.
And the side effects were your vision and your balance.
Yeah.
Which you never even think about, would you?
No, but it affected my my coordination up at that time as well. Like for the first few weeks, where I spent it in hospital, just recovering a bit. I had to get the nurses to cut up my food. I couldn't even grip a glass properly. I had to kind of zip through a straw because every time I tried to grip onto a glass or something, I couldn't lift it or whatever.
And it must be hard knowing that you can actually think straight, and well, obviously not in that time you can't think straight at all, but knowing that you can think and that you want to be able to do these things and not having the ability to do it.
So after your biopsy, what was your course of treatment and what were the side effects of that?
Well, the doctors at that time when I was in hospital, I seen the consultant at UCH Hospital, which was going to treat my tumour, and so she spoke to me and my parents about doing 6 weeks of intense radiotherapy.
Yeah.
So that would be 5 days a week for 6 weeks. So end of July, I was discharged from hospital, and I spent 2 months at home, which is kind of like they kind of called it a like a relaxation period or sort of
Like
just to kind of chill at home for a while until treatment started.
Yeah.
So what was the treatment after that?
And so during them few weeks leading up to treatment, I had to go to get a mask fitted. I had to go for sperm banking because where my tumour's sitting, they went to do radiotherapy to the spine as well, and they said that could affect like the lower organs and that in your body. Just had to go for like all the regular blood tests and that, but when treatment started, the doctors had already pre-booked transport because they said you're not going to be able to get there by yourself, and even with family helping you, they said you're just going to feel drained all the time.
And when you came to actually being treated, did you pick up any side effects from the radiotherapy itself? Yeah, big time. First couple of weeks wasn't too bad, but it was just after like the second or third week. Now, at the time I was a size small in clothes anyway, and because the treatment to the spine affected the stomach area, I wasn't eating. And so about a week or two after that, when I started losing weight rapidly, it just put me on another course of medication to try and make me eat more. But all my size small clothes were hanging off me. I kind of looked like Christian Bale from The Machinist at the time. And then it was a few weeks after that, I noticed my hair started kind of falling out then, and for me at that time, I was really upset because even though my hair was quite short at the time, but I just had like a really
thick mop of hair at the time.
Yeah, it's still a big thing, isn't
Yeah.
it? Even if you're a boy or a girl, female or male,
Yeah.
it's something that's on your face,
Yeah.
so
Yeah.
visible. It's,
Yeah.
it's almost like taking your diagnosis public.
Yeah, because everyone knew me for like my hair, like every day I had my hair in
Was
different
alright.
hairstyles. So yeah,
Yeah.
and so yeah, like I just noticed a few times like when I'd just be kind of fidgeting with my hair, like I'd be pulling it out, and then I just remember one morning I woke up and it wasn't until my sister or my dad said that oh, you a great lump has fallen out of your hair.
Yeah.
And
But
so,
you
yeah.
thought, like,
Yeah,
that's just hard.
yeah,
So was that from the radiotherapy?
Yeah.
See, I didn't know that radiotherapy could do that. I knew obviously chemotherapy could. But...
I thought
Yeah, but-
radiotherapy, when it's so if it was on your head, you'd lose that patch.
Yeah, because
Yeah.
I had it done to the whole of the head.
Oh, okay.
Yeah.
So that was your patch, almost.
Yeah.
So when you had radiotherapy, was it on your spine?
Spine, yeah.
You didn't, obviously, like the hair loss wasn't caused by that, but what was the effects? So weight loss, you said, because that area was being targeted?
Yeah, it was just because it was just to the whole of the spine. I think it was just where it was getting around the stomach area, and it was probably just the normal side effects of radiotherapy anyway.
So tiredness and stuff like that.
Yeah, tight. I mean, even to this day, I mean, I'm 7 years recovery, but even now, I don't know whether it's just.
No, I feel you. I feel you, man.
I don't know if it's still side effects of radiotherapy because
It takes
I don't know how long it takes to get out of your system.
It's known to be cancer survivors are known to be fatigued after. I get it all the time.
But
so.
I'm interested, like, I don't know the answer to this question, but if anyone that's listening does, what actually causes, so, like, the fatigue, like, 7 years later, like, what is the science behind it, you know?
Yeah.
Like, I don't, it's so common.
Yeah.
There's so many people that experience tiredness, and it lasts, like, in terms of side effects and recovery, the recovery is affected by that constant fatigue.
Yeah.
But I've just had people like I've tried to explain to people, and some people have just been ignorant about it and just said that because you're not doing nothing. And
Yeah, I've had that.
Yeah.
Don't worry, I've had that, and it's just you get so frustrated, don't you?
yeah, and it's yeah, sorry.
It's
probably
It's just hard to explain to anyone.
Yeah, I had that. When I was recovering from cancer, there was a few people that said to me, oh, why don't you go out and get a job now? Why don't you try and do this? No, I've just had like 2 years of chemotherapy. No. It's not like that. It doesn't work.
Because when I finished radiotherapy, like I hadn't even got a phone call yet from the local outpatient hospital in Hackney to start physiotherapy, and I'm not going to say anyone in particular, but just a few people have said like, "Oh, you're finished now. Why didn't you go out and get a job?" And I've thought to myself, who the hell is going to employ me? And it's like that's been like an ongoing worry for me over the past few years.
So would you say that your side effects has affected your friendship, employability, just your general?
Yeah,
life?
definitely. Because I'm a lot slower than I used to be. I can't even walk up and down 2 stairs now without having to hold on. And if even to like how do I put it? Try and get something off a top shelf in the kitchen cupboard, or just something simple. It's like.
And is that because of, so obviously pace has been affected,
yeah,
awareness?
awareness, because I still suffer from my dizzy spells really bad.
Yeah.
And it's just since the, and it's with my balance as well, but just since the radiotherapy or since they've done the biopsy really as well, like I'm of really wild fear of heights now, really bad. As where before I went into hospital, I was up roofs most of the time.
Really? Do you
Yeah.
know what causes that?
Sorry?
Wow. I wonder what causes that. Like,
I've no idea. I think it's because to go from roofing, being up scaffolding every day,
you're in brace heights.
and just to go to like being told no, you're sticking to the ground.
Yeah.
No.
However, I can say you've done yourself justice though, because when you said that you were afraid of heights, I laughed then, and it wasn't because I was being mean. The go aid, exactly that. So we went to a trip with Team Unite. There's an activities day, and we went to Go 8 for one of the days. And Derry decides to go on a Tarzan swing, which is essentially where you attach yourself and just go off.
Oh my god.
And one couldn't pull himself up because obviously he was like stuck there, weren't you? And
Did someone come and rescue you?
No, it was because everyone was down on the ground shouting up at me like, yeah, go on Derry, and
he just let himself
go. I kind of said something explicit. I said if you just go away, I said I'll turn your back to or something, or just keep quiet. I said I'll do it, and I don't know what happened, but all I remember was when I started swimming. I think Debbie kind of turned around and
was like,
yeah.
what was going on?
Everyone had a panic attack because he was just there like, I can't do anything because he couldn't move.
Yeah.
So then he was scared of heights as well, so that was like panicking. But you've done yourself justice, you did it.
I was going to say, you have challenged these side effects.
Yeah.
And that's what we're all about, isn't it? Like challenging.
100%.
Yeah.
Like, of course, being accepting and open-minded, because we know what it's like. Like, if you can't get a job, if you need time off, we get it. But also, when you can, trying to challenge those side effects and like making your recovery that bit easier or that bit different or that bit more exciting. Because I don't know about you, I don't want to be sitting about for years.
No,
and years.
oh no, definitely not.
But it's down to you. You don't want someone on your shoulder saying, oh, you know, chemo's finished now, go on, get back on it, you know, start where you carried off.
You just need to do it in your own time, but then at the same time, I think it's always nice to have that boost of someone saying, how are you today? Oh, maybe do you want to go for a walk?
It's about balance. And intentions. If you're not understanding they have good intentions, then it's fine. Yeah.
So one thing that I really am intrigued about, and I know you've mentioned it briefly in an episode before that you've been in with us with the Teen Tonight episode, you said that you lost your stability and your balance and you had trouble walking.
Yeah.
So how did you teach yourself to like walk again and gain stability?
It was mostly it was just when my dad at the time, I was living at my dad's at the time with my two sisters. My dad would either, when he was going to the local supermarket or corner shop, or he would send my sisters round just for milk or whatever to the corner shop, I'd go with my sisters because I wanted to try and just get out the house and that. And then it was along as well when I got referred to the local outpatient physio hospital in Hackney, St Leonard's. They had me going down there once a week in the gym, just walking about 100, 200 yards, just the size of a normal school gym. And I just said to one of the physios one day, I said instead of coming down here once a week, can you or one of your colleagues like take me out on the street to like somewhere really packed, like Oxford Street or London Bridge even, and
I remember you mentioning
This.
this.
Yeah. I love the story. It's
and because I said I get really nervous with crowds, and I want to be able to go shopping on my own again, and manage crowds and escalators and stairs, and so they decided to, because Liverpool Street was quite near at the time, to meet there, and during rush hour that gets pretty busy. Well, it's quite a busy station anyway.
Yeah.
And so just using the escalators there, and
Just
so
walking up and down the escalators and through the
yeah,
station.
well, yeah, and so because Liverpool Street was quite convenient to get to at the time, like via bus or train. They kind of challenged me to kind of meet them there, to go on my own
Yeah.
to the station.
Would you say it's gotten easier? So the first time you did it, it must have been petrifying.
Yeah,
And
yeah,
now
definitely.
You
Yeah.
met us today here, so
Yeah, but even now today, because I can't manage stairs anyway, never mind on a London bus, and there's days I get really tired and have to sit down a lot. It's just I've got one of those offer me a seat badges and cards, and even with my freedom pass, it's just asking people for a seat even, and then when I've been sat in the disabled areas on a bus, people question me,
that's
and
disgusting.
and I don't know.
People are ignorant.
I've got into quite a few arguments with people on the bus.
Good on you.
And,
But how do they challenge you? How can they say
'Cause-
that?
because-
Can you prove it or whatever? It's like
yeah,
Do you want me to
But,
bring my documents out?
but I mean, one episode that happened last year, I got into an argument with someone, and he had the audacity to rip the badge off my coat, and
Wow.
and throw it off the bus while the doors were.
Oh my
Was
God.
he old? Just curious? Or?
No, he was in his say he was in his 40s or 50s, and
So what was he needing a seat for?
no, it wasn't him. He's like he looked at me. He said what? He kind of basically said, when you get up, let someone sit down who needs it. And I said, and I pointed to the sticker. I said for those who are less able to stand. And I showed him the scar. I showed him my freedom pass. I said,
You shouldn't even need to do that.
No.
It's no one else's business.
I said at the time, I said I'm 5 years getting over a brain tumour. I said I can't climb upstairs. I says I can barely stand. I'm tired all the time. And then another episode a few months ago, it was just some lady that I was on the phone to someone at the time and it was a support worker at the time, conveniently, but it was just this woman was getting off the bus, and she kind of on her way out get up for the people who need it, and it's I mean, and then
The thing is, half of the time they probably don't need it, they're just being lazy.
but
I can't believe that.
No, it's disgusting.
You, like, it's just proven in this chat, you have had so many side effects
yeah,
that I've been a cancer patient and I'm oblivious to, because our houses have been different and
yeah,
we've had to undergo different things, but things that you have experienced have been life-changing. Balance, awareness, walking, learning to walk again, and
but it's
it stays with you, and you're trying your best to adapt and get back to normal. And you
Yeah.
have improved significantly. Like
yeah.
I wouldn't know all of these things until
No.
speaking to you.
But but even like I just forgot to mention there earlier, it's when they done the radiotherapy, because where my tumour's sitting, it's sitting kind of like right in front of the pituitary gland.
Right.
Now the pituitary gland affects your cognitive development, your memory, your coordination, all that, and so that's why my short-term memory, particularly with names.
I'm like, oh, Derry, who are you? It's like, oh, okay.
You have an excuse though.
Yeah, exactly.
I just keep my brain.
But yeah, like names is really bad. So
we'll let you off.
yeah.
So just point, friend.
I know you. Do I know? I don't.
I mean, most of the guys in Teens Unite, like, I'll tell you, I've turned up to loads of events where I've seen them again and my mind just goes blank.
The thing is though, you're doing incredibly well. I just want to say, like, for what you've been through and the effects, good for you. And good for you to still have a smile on your face and be like, do you know what, today we're going to come and record an episode. I'm going to meet you there. I'm going to do this. And like, once upon a time, you probably only thought of doing that. So good for you.
Yeah, definitely. And what would you say to somebody who may be going through a similar situation that you went through? Because obviously I know you had to have baby steps again and learn how to walk, learn how to do everything essentially. So what would you say to someone that maybe listening to this that is in a similar position to you?
I'd just say that just don't let anyone get you down, really. Like, if anyone says, I mean, apart from the doctor at the time saying to me that I'll never go back to construction, but I reckon if it weren't for me still getting dizzy spells or balance problems, I probably would have returned to that. But I would say to someone, just like, don't let anyone kind of put you down, or don't give up. Just keep pushing yourself.
I mean, you're living proof of it, so
yeah.
But yeah.
I want to like give a clap.
Yeah, take a bow, Derry, take a bow.
And this is my TED talk. Well, thank you so much. What you have said is incredible. I feel like every minute is so valuable, and hopefully, what's the stat now? Like 1 in 2 get cancer.
Yeah.
So I think that although for you or I it might seem quite niche, like a brain tumour, I think there are so many people that are going through it or know someone that is, and to know the reality of it, because I've never heard like the truth unfold like that, like in actual details and the side effects and things you've had to come across and hate you've received, things. It's so powerful. So thank you.
Yeah, thank you so much. You've been a pleasure.
You're a legend.
The legend is here. We're so honoured to have you on.
Tarzan is here. This was a side effects episode, and we hope you thoroughly enjoyed it. We both have blood cancers, so although we had different types, I had Hodgkin's and you had leukemia. There are some differentiations between us, but we also are almost in like one kind of field of cancer. So I'm sure if you have a different diagnosis, you have different realities, and that is why we try and bring on guests to be a bit more representative.
I think, like going on from what you were saying, I think we all get the basics. I mean, that's known to everyone, but I just think it depends on luck with, you know, how much you branch out of the side effects, because I know that I remember reading it online. You've got like the basic tier, then the what did they call it on Macmillan? It was like basic,
like intermediate.
Yeah, and then like high risk, and then I feel like a lot of us fall in between the basic and intermediate.
And I think wherever you fall within that will be the makeup of your after cancer, and how you will experience things.
No, for sure.
And we hope you have found it very useful. And please comment on this YouTube video if you're watching YouTube, or give us a lovely 5-star rating.
Thank you so much.
On iTunes or whatever platform you're listening on, or just go on our socials at the cpodcast on Instagram, Facebook, Twitter, and DM us or reply to a story or whatever. Just get involved, because you can sit here with us if you'd wish, or just tell us how you're feeling or what you think.
Definitely, and I think as well, if you're interested to know if anyone else has had a side effect that may not have been mentioned in this podcast, comment down below on a post that is to do with this episode, purely because you never know, let's just share out our side effects, and someone may come across your comment and
get
write
some
about it, and you may find a common interest with someone, not necessarily a common interest, but a relatable situation that you may not have felt yourself in before. So yeah,
it's definitely worthwhile. So on that note, we will be over and out.
Yes.
Make sure you've caught up on our previous episodes. So right back from episode 1, introduction, a bit about us. So if you're tuning in now and don't know who the hell we are, click on Beth's diagnosis, Leanne's diagnosis, and have a look at the other topics and fill in the gaps where you haven't listened previously. We look forward to seeing you soon.
Yes, we cannot wait to bring you the next episode. So thank you so much for listening. We hope you have a great evening, morning, party, holiday, whatever you're doing, wherever you are, I don't know.
Have a good one, and we'll see you next time.
See you later. Bye.